Okay, so we are still looking at all the various topics that are involved in pharmacology, and we're trying to have like an introduction to all of them. So move today, and today we'll talk about 20 topics. Okay, so what we have on the first topic, which we are talking about here, is the pharmacotherapy of infertility and erectile dysfunction. Pharmacotherapy of infertility and erectile dysfunction. Now, for pharmacotherapy, of course, you are trying to use that's the drugs. Which drugs can I be able to use to treat, infertility and also erectile dysfunction? So what we have is this as follows. Okay, erectile dysfunction, of course, the man is not able to, keep up. Okay, so pharmacotherapy for infertility. Now we'll just list the drugs and go. Later on, we'll come back and talk about their pharmacology, right? So it focuses on stimulating ovulation in women. That's infertility in general. It's either ovulation in women or sperm production in men. While erectile dysfunction, this one is basically for men. The man is not able to maintain an erection. So treatment primarily relies on drugs that enhance penile blood flow. We'll look at all those drugs, okay? So for infertility, let's take women. So examples of drugs include drugs like the Clomiphene citrate. Okay, it's a first-line drug for ovulation induction. It will make the woman want to release an egg. This is just a summary. We'll still come back later and talk about each of these drugs. They'll have Letrozole. Okay, it's an aromatase inhibitor. It increases. Okay, it's used as an alternative for Clomiphene. We have other drugs like tamoxifen. We have Metformin, and we have the Gonadotropins like the follicle stimulating hormone, the luteinizing hormone, the human chorionic gonadotropin. Okay, so that's what we got. Now, in men, you use the gonadotropins like human chorionic gonadotropin and follicle stimulating hormone. This ones will stimulate sperm to be produced, so the man will now have sperm to release. We have anti-estrogens like Clomiphene and tamoxifen. They are used to improve sperm count. So it's not all about discharging, but do you have a lot of sperm in the discharge? They'll have aromatase inhibitors like the Letrozole and the anastrozole. Those ones, they improve testosterone to estrogen ratio in men that are having infertility. So they'll make the man to have more testosterone than estrogen. Okay. Then for the erectile dysfunction now, that's when you have all those drugs like the sildenafil, citrate coming in. So, so we have all those phosphodiesterase type 5, like the sildenafil, that's Viagra. We have tadalafil, also known as Cialis. We have the vardenafil. We have the avanafil. So their mechanism of action is they enhance nitric oxide mediated vasodilation in penile tissue. It will improve how the penis is getting erected. Okay. Note, it requires sexual stimulation to be effective. Okay. So second line of treatment, you have all those drugs like the intracavernosal injection. They'll inject you right into the muscles of the penis. So examples of drugs include the aprostadil. Okay, we have the papaverine. We have the phentolamine. Okay, those ones, they directly induce erection by vasodilation. Okay, they also have all those intraurethral aprostadil suppositories. They put it right into your urethra. Okay, so this is just examples of this drug. Then we have hormonal therapies where they try to add your levels of testosterone, because testosterone makes up a man. Other agents include dopaminergic drugs, okay, and some other drugs that are still under trials. Then adjunctive and alternative therapies include vacuum erection devices and also the penile prosthesis. That's surgical option. Okay, they put something into your penis that could just keep it erected. There's a summary for this aspect of pharmacology.